Welcome back, guys. Today we'll discuss about psychopharmacology or antipsychiatric drugs or psychiatric drugs. Psychiatric drugs are the drugs which is used for the treatment of psychiatric condition that we'll discuss in this video. Psychiatric drugs or psychiatric medication or psychotropic drugs are the drugs which is used for the treatment of psychiatric condition, but always just keep one point in your mind that it cannot cure the condition, but we can reduce the symptom as well as reduce the re-entry of the symptoms into person. That's it. Type of psychiatric medications: we have antidepressants, antipsychotics, anxiolytic drugs, anti-manic drugs, and mood stabilizers. So these are all the drugs normally we can see in the market, in the industry, for the treatment of psychiatric condition. Well, coming to the type of drugs, first thing is antidepressants. Antidepressants we will give for moderate and severe depression. It will not be effective in the case of mild depression. Okay, and antidepressants are usually prescribed for the treatment of depression. The exact pathophysiology of this antidepressant or behind antidepressant is still unknown. That means the mechanism of action, how it is affecting and how the thing is acting in our brain and nerves. But the researchers are saying that it will stimulate the amount of serotonin and noradrenaline. These are the two chemicals present in our brain which helps to elevate, helps to improve your mood and emotion. So these antidepressants will give effect on the serotonin and noradrenaline, and automatically your mood and emotions will get come to a normal level. But we don't know the actual physiology still. Then again, I told you already, antidepressants are effective for moderate and severe depression, and it is not usually recommended for mild depression because you'll not get any result. And while coming to the dosage and duration, always start from the lowest possible dose, and usually need to administer for 1 to 2 weeks without missing a single dose. That is very important. Without missing a single dose, you have to administer these drugs. Then only you will get the better result. And if the drug is taking for continuous 4 weeks and there is no changes in the mood, means you need to talk to your doctor, and doctor will suggest other psychiatric drugs, and they will go for other therapies and different kind of techniques to reduce the symptoms. So now we will see the types of antidepressants. Among that, first group is selective serotonin reuptake inhibitors. This serotonin reuptake inhibitors is helping to increase the amount of serotonin. Serotonin is responsible for stimulating your mood. So okay, you can see here some examples: fluoxetine, paroxetine, etc. Sertraline is another commonly used antidepressants, and the company names also you can see here. Okay, so this is about the first type of antidepressant. The next type of antidepressant is selective serotonin and norepinephrine reuptake inhibitors. That is another type of antidepressant. These antidepressants will improve the amount of serotonin and norepinephrine, which is responsible for mood and emotion stimulation. Okay, here you can see some example like duloxetine, venlafaxine, etc. The next type of antidepressant is atypical antidepressants. Example: trazodone, mirtazapine, etc. Next is tricyclic antidepressants or TCAs. Example: imipramine, nortriptyline, amitriptyline, doxepin, desipramine, etc. Okay, these drugs has more side effects than other antidepressants. So tricyclic antidepressants generally are not prescribed unless you have tried other antidepressants and there is no effect. If you're not getting result from others antidepressant only, the psychiatrist will go with tricyclic antidepressant because it has lot more side effects comparing to other drugs. Then next is monoamine oxidase inhibitors. That is another thing. Monoamine oxidase inhibitors. Example: tranicyclopine, phenylcynine, isocarboxide, etc. And these have some more side effects comparing to other antidepressant drugs. And amitriptyline is a tricyclic antidepressant which is usually used to treat neuropathic pain. The patient is complaining pain, and after doing X-ray scans and test, the other doctors cannot find out the pain, from where the pain is coming, means that time we'll consider it as neuropathic pain, and for this neuropathic pain we will give amitriptyline. Amitriptyline is a tricyclic antidepressant. So these are all the type of antidepressants which normally we will give for the treatment of depression. Well, coming to the side effect, I told you there are a lot side effects for each and every psychiatric drugs, and these are all the side effects for antidepressants: confusion, agitation, muscle twitching, diarrhea, seizures, arrhythmia, unconsciousness, agitation, stomach problems, shivering, headache, hyponatremia, that means reduced potassium level in the body, etc. So these are all some of the side effects of antidepressants. Next group of drug is antipsychotics. So first one is antidepressant, and we have seen the type of antidepressants and side effects also. Tricyclic antidepressant is very severe side effect showing antidepressant comparing to other antidepressants. So tricyclic always will give unless they are not getting any result from other antidepressants. Next group is antipsychotics. Antipsychotic drugs are mainly used for the treatment of anxiety, mania, schizophrenia, and other related mental health condition. That means schizophrenia related mental health condition. And mainly used antipsychotic drugs are risperidone, quetiapine, olanzapine, etc. And here you can see the company names also, molecule name also, as well as the company name also. These are all the commonly used antipsychotic drugs. So when we come to an explanation, what is antipsychotic means? It is used for the treatment of psychosis. Psychosis means what? Disconnection from the reality, or not connected to the reality, or loss of connect with the reality, and also used for the treatment of delusion, hallucination, attention deficit and hyperactivity disorders, delirium, dementia, depression, eating disorders, etc. For all this condition, normally the psychiatrist will suggest antipsychotic drugs, and antipsychotic drug will give the results very slowly. So we need to wait, and we need enough patience to wait for the result. Suddenly you will not get any results from antipsychotics. Okay, so this is about antipsychotics. So antipsychotic drugs work on dopamine and serotonin. Already you know what is dopamine and serotonin. These are all the hormones which is responsible for mood stimulation, and these chemicals which is present in the brain. And when we give antipsychotic drugs, what will happen means these drugs will act on dopamine and serotonin, and which helps to relieve psychosis quickly. And we can take antipsychotics as liquid, pills, or as an injection. It can also take in the form of long-acting injectable antipsychotic medication. Okay, so this is about antipsychotic. While coming to the side effects, same like other antidepressants, antimanic, here also a lot of side effects, and it can reduce the sex drive, mood problems will arise, like mood swings will arise, weight gain, pleasure changes, okay, then blood pressure problems, tardive dyskinesia, that means movement problem, muscle rigidity, weight gain, drowsiness, dizziness, nausea, dry mouth, constipation, vision problem, hearing problem, seizures, blood pressure problem, like lot of side effects we can see when we take antipsychotic drugs. Next group is anti-anxiety. So we had a discussion regarding depressants and antipsychotic drugs. Next one is anti-anxiety. This is the third group of psychiatric drugs. Okay, antipsychotic drugs help to reduce anxiety. From the word itself you will get the meaning what is anti-anxiety. Okay, this drugs is used to reduce anxiety, and it also used for extreme panic case, panic attack case, extreme fear case, and the people those who are complaining about worrying. Okay, and benzodiazepine is the most commonly used anxiety drugs and can treat generalized anxiety disorder. Benzodiazepine. So when someone is asking about anti-anxiety drugs, suddenly you have to tell about benzodiazepine. So benzodiazepine is the most commonly used anti-anxiety drug, and type of benzodiazepine include clonazepam, alprazolam, lorazepam. This lorazepam is a short-acting benzodiazepine. So benzodiazepine is the most commonly used anti-anxiety drug. Then barbiturate. These are all the other anti-anxiety drug. Anti-anxiety drug is otherwise known as anxiolytic drugs. Okay, so this is the other anti-anxiety or anxiolytic drugs, and examples for this barbiturates are Pentobarbital, Phenobarbital, Amobarbital, etc. Okay, Pentobarbital, Phenobarbital, Amobarbital, etc. This is also used for anxiety only. Then beta blockers. Beta blockers is is an off-label anxiolytic drugs. Actually, it is not coming under psychiatric drugs, but this is an off-label anxiolytic drug. Basically, beta blockers will used for the treatment of heart problems. Okay, so when the patient is complaining about increasing the heart rate, tiredness, drowsiness, means in that case, first the doctors will write beta blockers. Okay. This is an off-label anxiolytic drugs, and which will definitely helps to reduce the symptoms of anxiety, sweating, shivering, etc. And this anxiolytic drug, off-label anxiolytic drug, that is beta blockers, will also write for phobia, fear. In this cases, tensions. In this cases also, the doctors will write this beta blockers because it can reduce the over activities of the heart. Okay, so this is other anxiolytic drugs. And while coming to the side effects, again it's the same side effects only: nausea, blood vision, headache, confusion, tiredness, changing the blood pressures, nightmares, etc., etc. Next type of antipsychotic drug is stimulants. It is a type of drugs which used to increase the alertness, attention and energy. So this is a type of drug which is used for increasing your energy. The patient is telling, I'm restless, tired, okay, I couldn't orient it, I couldn't understand the time where I'm sitting. In that cases, okay, the doctor will write or the psychiatrist will write stimulants. Stimulants mainly used for the treatment of attention deficit and hyperactivity. That means ADHD, and occasionally for depression, and in the case of chronic medical condition, chronic severe medical condition also will write the stimulants. Example for stimulants include Methylphenidate, Amphetamine, etc. So these are also examples for stimulants. Stimulants is used for the treatment of ADHD and for depression, and the patient is having some chronic medical condition. In that case also we will use stimulants, because stimulants will increase your alertness, increase your attention, as well as your energy level will increase. Then side effects, as usual: sleep disturbances, appetite problem, stomach problem, headache, motor and verbal tics, like you couldn't maintain the balance of your body sometime if you take stimulants in extra amount. The next type of antipsychotic drug is, or psychotropic drug is, mood stabilizers or anti-manic drugs. So we had a discussion regarding antipsychotic, antidepressants, okay, anti-anxiety or anxiolytic drugs, stimulants, and last one is mood stabilizers or anti-manic drugs. Word itself you will get meaning mood stabilizers. It helps to maintain your mood, or anti-manic, it will use to reduce mania, excitement, overactivities, okay, and also will used for mood swings and irritations. Lithium is the most commonly used anti-manic drug. So when someone is asking about anti-manic drugs, suddenly you have to say lithium, because lithium is the most commonly used anti-manic drugs, and it also used for the treatment of depression, schizoaffective disorder, and in some mental illness also. Other anti-manic drugs are carbamazepine. Always we will tell together lithium and carbamazepine. Okay, lithium is the most commonly used anti-manic drug, and apart from that, carbamazepine, lamotrigine, oxcarbazepine, etc. While coming to the side effects, again, itching, rashes, thirst problems, urination, shakiness like tremor and rigidity, nausea, vision problem, speech problem, hallucination, fast heartbeat, sometimes the patient will tell, sometimes slow heartbeat also the patient will tell. So these are all the side effects of this drug. Which one? Anti-manic drug. Always remember, lithium is the most commonly used anti-manic drug or mood stabilizers. After that, carbamazepine. Then next type of antipsychotic drug, okay, that is anticonvulsants. Anticonvulsants examples: valproic acid. Valproic acid also we are using as a mood stabilizer. That is actually an anticonvulsant drug, means for seizures, for convulsions, fits and all, valproic acid will use. Valproic acid also we will use as a mood stabilizer. For this also a lot of side effects like dizziness, headache, constipation, weight problems, okay, weight gain problems, back pain, mood swings, etc., etc., etc. Next, who needs special attention? Older people, pregnant, and the person going to become pregnant, children, adolescent. This many people need special attention because I told you lot of side effects than the medications here. In every type of drugs, lot of side effects, and I give more importance for side effects than the type of medication and pathophysiology of medication here, right, in this discussions. Okay, so side effects is more. So when we give to older adults or children or a pregnant woman or going to conceive someone, in that cases, please do suggest them and inform them and get the consent from them and tell the side effects of each drugs. And while writing also, the doctors need to be very cautious, and while administering also, there are a lot of procedures are there, and all the things need to follow. So this is about antipsychotic or psychotropic drugs. Antipsychotic or psychotropic drugs are the drugs which is used for the treatment of psychiatric condition. Psychiatric conditions are treated with the therapies comparing to medication, but sometimes the medications also needed along with the therapies. Hope you understand, guys. Thank you. So psychiatric drugs means the drugs which is used for the treatment of psychiatric conditions. Hope you understand, guys.